What is, in your opinion, what happens in the lungs, which I think can mean lungs, in someone who gets toxins, gets affected? I'm not sure what exactly that means. I think what happens in your lungs when you get toxic exposure. And this gets to the heart of the confusion between the cause of the illness and the reaction to the illness. When you have a toxic exposure, your body has to try to get the toxins out of your body. There is no other choice. Well, the other choice is to completely metabolize these toxins. In other words, internally digest them. So those really are the two ways. You can internally digest some, but most of them, the body has elaborate and, well-designed mechanisms for using an inflammatory response and using the elimination channels such as mucus and cough and urination and bowel movements to flush these toxins out of our body. That's why we make mucus. That's why we cough. That's why we have pus from our eyes. These are elimination channels. And unfortunately, the entire medical community is confused about what the problem is and what the solution is. The problem is the poison, the toxin. The solution is what we call being sick. If there's anything that has to come out of this mess, and I've written many books about this, we have to change our entire conception of what it means to be sick. Because the symptoms that we see of being sick are the body's way of healing, pure and simple. If you have just, toxins in your throat and your tonsils get inflamed and they start dying, the bacteria come to eat the dead and dying debris. We call that having strep throat. Once the bacteria do their job and get rid of the toxins, then the body can heal and restore the tonsils to good health. The reason that antibiotics seem to work is they thwart that healing process. And then typically what happens is either you go through the whole thing over and over again, or you get into a worse situation and now you have a worse toxic problem. And that little story there describes pretty much the entire Western medical paradigm.